Being a mentor mother, I love the fact that there's a great difference that one makes, not just in one person, but in many people's lives.
Living with HIV doesn't change much for me. I can do anything that I put my mind to.
They have given me a job. M2M has bring a total change in my life. And this is just the beginning.
I am a voice in my home. My husband respects me so much. It's all about saving lives by being a living example.
Ineyo chimene ndingafotokoze ndichonena kuti ndikuyamikira to basi. Ineyo ndiyamikire motere kunena zonena kuti bungwe limene lili ife lalithandiza kumbali ya ife alangizi ndi anthu amene tikuwayendera.
The women are the people who are becoming the breadwinners in the families. They are the people that are changing the way we lived before. Women are so capable.
Over the last 20 years, Mothers2Mothers has recognized a simple yet powerful truth. Women are uniquely placed to make a huge difference to the health, well-being, and potential of their own families and wider communities. Mothers2Mothers was born in 2001 at a time of crisis.
Back in the day, the mention of HIV and AIDS was like a curse. All people had was death.
There were so many infections at my community. The infants were infected.
Stigma and discrimination, a lack of accurate information, and severely overcrowded health centers made it difficult for pregnant women to access life-saving HIV testing and treatment. 1,500 babies contracted HIV each day globally, the majority in sub-Saharan Africa. If no interventions were made, 1 out of 3 mothers living with HIV would pass the virus onto their children during pregnancy, birth, or breastfeeding.
It was really scary because I was the first person in the family to be HIV positive. I was living the spiritual life and I thought maybe I've done a sin. I was just scared to tell my mother that I'm HIV positive.
Fast forward 20 years and everything has changed. Mothers2Mothers developed a unique model, the Mentor Mother model, which sees a mother living with HIV trained and employed to provide health services and education to other women and families, both at health facilities and door-to-door in the community.
We believe that the fact that we are not only based in our clinics, that we are also based in the communities, it gives us a chance to provide the extra education, the services to our clients where they are.
The nurses and doctors are way too busy to sit down with a client who is crying. But we as Mentor Mothers, we have all the time to sit down and with them, to encourage them, to give them hope.
The Mentor Mothers are the people who have walked the same journey as our clients. They know how a woman feels when she tests positive. She knows how it feels to raise a child.
I do believe that we are at the right time, at the right place.
From an initial focus on preventing mother-to-child transmission of HIV, we now provide family-centric health services and education to women, children, and adolescents. Since we started, we have virtually eliminated the transmission of HIV from mother to baby among our enrolled clients for 7 years in a row, reached over 13.5 million women, children, and families with life-changing health services and education. across 12 African nations by creating more than 11,000 jobs for women living with HIV to guarantee health for all. A healthier, more equitable world is possible when we invest in women and put communities at the center of the solution. We're proud of all we've achieved, but we have so much more to do. The world is not on track to meet the global goal to end HIV and AIDS by 2030. We are failing the next generation. Still, 1 out of 11 children born in sub-Saharan Africa dies before age 5. And girls account for 6 in 7 new HIV infections among adolescents aged 15 to 19. COVID-19 continues to disrupt health services across the African continent and is especially risky for people living with HIV. We've worked hard to protect the communities we serve, but our work is not done. Decades of progress hang in the balance.
I do love my job because it makes me feel good. It makes me feel like I'm serving my purpose, because empowering women, it makes me happy.
When women lead, they are able to do so many things because women are so powerful and they are strong and patient.
M2M Mentor Mothers are truly changing a generation.
I think I'll still continue being a mentor mother until every child is HIV negative, until all these women are empowered.
We believe
in the power of women.